Hello, good morning. Myself Dr Ravina Kalyan, Faculty of Physiotherapy Department in RPIIT, Technical and Medical Campus, Karnal. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll discuss about the brachial artery anatomy. So brachial artery is a major blood vessel of the upper arm, and it is a continuation of the axillary artery beyond the lower margin of teres major muscle. It continues down the ventral surface of the arm until it reaches the cubital fossa at the elbow. So it then divides into the radial and ulnar arteries which run down the forearm. The pulse of the brachial artery is palpable on the anterior aspect of the elbow, medial to the tendon of the biceps, and with the use of stethoscope and sphygmometer, that is blood pressure cuff, often used to measure the blood pressure. Next is structure. So the brachial artery gives rise to the flowing branches. First is profunda brachii arteries, that is deep brachial artery. Second is superior ulnar collateral artery. Third is inferior ulnar collateral artery. Fourth is radial artery, that is a terminal branch. Fifth is ulnar artery, which is also a terminal branch of the brachial artery. Sixth is nutrient branches to the humerus. So it also gives rise to important anastomotic network to the elbow, and as the axillary artery, the shoulder. So this figure represents the courses of brachial artery. So it starts from the lower border of the teres major and it becomes the brachial artery. Above the lower border of teres major, brachial artery is a axillary artery. So brachial artery is the continuation of the axillary artery. Here it is present later to the median nerve, and then it passes between the cubital fossa. So brachial artery, when enter into the cubital fossa, it give two branches, radial and the ulnar. Radial supply through the thumb side or the lateral side of the arm, and ulnar artery supply to the blood from the medial side of the forearm and hand. So the radial and ulnar arteries are formed by the bifurcation of the brachial artery within the cubital fossa. So the radial artery supplies the posterior lateral aspect of the forearm. It contributes to anastomotic networks surrounding the elbow joint and the carpal bones. So the radial pulse be palpated in the distal forearm immediately later to the prominent tendon of the flexor carpi radialis muscle. Ulnar artery. So ulnar artery supplies the anterior medial aspect of the forearm. It contributes to an anastomotic network surrounding the elbow joint. Thank you.